Hi, I'm Julie Mills Watson and founder of Body of Health, home of the Lymph Clinic. And we've been specializing in lymphatic therapies for years, which includes plastic surgery recovery. So I would love to be your recovery navigator, and here's how we can help. So first of all, you have made a decision to make a change in your life. And that's a big decision. You also went through the trouble of research and you chose the perfect doctor. And then you took the time off of work and from family to have this done. And then you invested in this particular procedure. Now, the most important part of all is for you to recover. So I wanted to share a little bit about what's happening with your body for recovery. So if you look at the chart here, I love this chart because it shows you what's happening with your lymphatic system, and that's my specialty. So by the time you come to see me, it's been a couple of weeks, let's say 10 days to 2 weeks. So you're starting to heal up, and our job is to help you heal and absorb this inflammation and fluid. So let me explain a little bit. So this is your lymphatic system. It's its own system. Like you have a cardiovascular system, a respiratory system, you have a lymphatic system. It's made up of vessels and nodes. And it's also, you divide it up into quadrants. So if you use your navel as your reference point, you divide the body in half and then you split it right down the middle. Okay? So when a cannula is put in, let's say for liposuction, it's right here at the level of skin, which is right where the lymph vessels are. And it tears up these tiny little vessels, which is okay because they will grow back. Okay, so once they are trying to grow back, they have to go in different directions. They literally, at these watersheds, go in different directions. You might be experiencing a little hardening going on right in these areas, right on the sides, or right here in the middle. And that's because the lymph vessels are trying to go in a different direction. The other thing that has happened during your surgery is you might have had a tummy tuck. And that moves this watershed a little bit further down. So you're going to have a lot more pooling down at the lower part of the abdomen. So my job and my staff's job is to help these lymph vessels grow in the correct direction. So I hope that gives you a little bit of better idea of what's happening in the body so that your recovery will be a little bit simpler. Okay, so we've talked about that you've had your surgery and what's going on inside the body when you're trying to heal. And so I would love to navigate you through 5 different steps to help you hurt less, heal quicker, and have a better quality of life. The first step is your garment. It's very, very important. You got to think about the function of the garment and not the look of the garment. Because this is not about looking sexy at this point. This is about recovery. So what you want the garment to do is to direct the fluid to the major dumping stations. And we talked about this a little bit earlier. But I wanted to remind you of this little chart and how you're divided up into quadrants. And your major dumping stations are going to be at the crease of the leg and under the arms. So you want to make sure you get a garment that directs the fluids all the way there. And this is perfect. I absolutely love this garment because it's going to direct the fluid all the way down to the crease of the leg. If you were to cut this off too short, then it's not going to direct it far enough and you're going to pool. That's when you're going to get those little hard areas, and I'm sure you all know what I'm talking about with that. Also, around the back, and to help with the sides, you want a garment that's going to be a high back, something that's going to direct fluid all the way up to the underarms, or what we call the axillaries. Okay? The other thing is, if you've got a lot of a curve to the back side, you want to make sure the garment is very tight. If you can grab a handful of your garment, then it's not tight enough, because the more it can press against the muscle, the more fluid is absorbed. So make sure you get the right garment and the right fit, and you'll heal a lot quicker. Okay, so we've been through garments, which is step number 1, and navigating through this journey of recovery, we want step number 2, which is self-care. The first thing you want to do is drink lots of water. That's very simple. Drink tons of water. Don't even want to tell you how many glasses of water to drink. What I want you to do is drink enough until your urine is clear. And what this will do is help plump up your lymph vessels and your blood vessels to take on more edema. The next thing you want to do is self-massage. Get deep in there and move tissue, because what you're trying to do is get the proteins out of the tissues. And this is a big job for the lymphatic system, and it needs all the help it can get. So really massage as much as you can. The next thing is dry brushing. So when you move skin, you move lymph. And so everybody asks me, what do I do with a dry brush? What direction do I go? Well, you have major dumping stations we talked about, and that's at the crease of the legs and here under the arms. And you're divided into quadrants. Use your belly button as your reference point. And you want to brush to the crease of the leg, and if you've had anything done with your thigh, brush to the crease of the leg. And then also with your upper torso. Everything from the back needs to come around to the front, and same if you've had any kind of transfer, it needs to come around to the front. So dry brushing is awesome. And the last but not least is nutrition. You want to feed your cells what they need. So think of nutrient-dense foods, no fatty foods, no fried foods. This causes inflammation. Stick with your fruits and vegetables, and your supplements would be awesome as well, as far as turmeric or any anti-inflammatory supplements. So stick with your fruits and vegetables and you'll do great. Okay, so on to step number 3 of our navigating for your recovery. And that step is lymph therapies. You want to make sure that when you choose a lymphatic therapist, that it's someone that is trained and knows the lymphatic system. This is a totally different therapy. It is not your regular massage. What you might have had right after surgery is massage to get not only the lymph system going, but also the blood, and to actually move fluid out of the body. What we're teaching your body to do is absorb this fluid and become stronger for you. So you want to open pathways. That's one of the things we do, and that's working with the lymph nodes in those dumping stations we talked about earlier, which are under the arms and at the crease of the legs. We also want to redirect lymph flow, because sometimes those vessels get a little confused and we have to manually move tissue, which moves lymph, in the direction that it should go. And then the other thing that we're doing is it's a very light touch. The only hard parts that we're doing is breaking up the proteins that have gelled in the tissues. Other than that, just moving skin moves lymph. Okay, so we are still navigating through our recovery, and we are on step number 4, which is really important, but it's very simple. It's rest. Your doctors have given you the time off, so now please take it. If you try to do too much too soon, you just will not recover. I've been doing this for enough years to see. One of the things is your immune system has been lowered because of this surgery. It's a shock to the body. So wound healing is very, very important. And you have some large incisions or maybe some little tiny ones. But it's very important that you rest so these things can heal. The other thing is your lymph vessels are like little alfalfa sprouts. And so as they're growing, they're like little teeny tiny hairs. And they just can't take on the capacity that a mature, grown lymph vessel can take on. So remember that it takes a few weeks to a few months for these vessels to grow to maturity. So take your time, prop up your feet, and rest, and let your body do the healing. Okay, we're at step number 5 in navigating your recovery, and that is communication. As simple as that might sound, it is very important. So ask questions. If you don't understand something, make sure you ask questions. No question is a dumb question. The next thing you need to do is your homework. When you've been told to do self-care, you need to make sure you do all of it, not just some of it. And don't do it part of the time, do it all of the time. It will make a world of difference. And the next thing is, if you have any concerns, if something's not feeling right, if a scar's not healing correctly, then make sure you call your health team and make sure you get some answers and ways to follow up. And last but not least, we are here to help you. So make sure you reach out to us and let us help you in your journey.